Hi, this is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C. Today, I'm going to talk about rhinoplasties. So, what is a rhinoplasty? A rhinoplasty just basically is reshaping of your nose. You know, there is a reconstructive trauma aspect to rhinoplasty. We're not going to talk about those. We're just going to talk about cosmetic rhinoplasty, which is basically if you don't like the shape of your nose, it could be changed. And with that, the function of your nose can also be improved. So I get a lot of questions from patients about the function of their nose because everybody knows someone that might have had a rhinoplasty and now they have some breathing difficulties, or vice versa. They had breathing difficulties and they had cosmetic rhinoplasty, and actually their breathing improved. And they're like, God, gee, doctor, I can breathe so much better. Thank you. And they didn't expect that to happen, which is a good thing, right? So, but rhinoplasty is really one of my most favorite procedures, simply because you can instantly transform someone. It is an object that is right in the middle of your face, and it sticks out. So it's the most prominent thing on your face. So it can take a lot of attention if it doesn't blend into your face, and if it's not in harmony with all your other facial structures. For example, let's say you have a small face or a very narrow face, and you have a big fat nose on your face. You know, when someone looks at you, they usually look straight at you. It might grab that person's attention, and so the job of a rhinoplasty is to make sure the nose blends into the face and doesn't take all the attention, okay? That's really the purpose. And that's why we perceive someone as attractive versus non-attractive. And of course, it has to do with ethnicity, with culture, geography, all of those things. It's like people in Scandinavia that have very small upturned noses, and in Africa, they have very wide noses, and that has to do with the climate, okay? If you live in a very cold climate, anything that's sticking out, it could be subject to freezing, right? So that's why evolution made it smaller and made the nostrils narrower so you don't freeze when you breathe. And vice versa, you go to the south in warmer areas like Africa, it's very hot, it's very humid, so you need big nostrils and you need a big white nose so you can breathe better. And those are evolutionary aspects of why our noses look different, why there is ethnic noses. So it's very important to keep the ethnicity when someone gets a rhinoplasty. You don't want to put a tiny Scandinavian upturned nose on someone that is from, let's say, South America or the Middle East or something. It's just not going to look right. It's something. If something doesn't look right, usually we would perceive it as unnatural. So there's no one today that has not seen an unnatural nose. And the reason is because of what I just mentioned, is whenever we don't address the nose within the entire face. So it's very important that you really, when you choose a surgeon for your rhinoplasty, that the surgeon understands these things. And I see too many of my colleagues, they have their, what they call signature nose. Honestly, I don't know what that means. Like, what is a signature nose? Meaning you put your nose on someone else's face, a nose that you think looks beautiful on someone else's face. Well, what if that nose does not look attractive on that face? Okay, because of the things that I just mentioned. So the purpose of a rhinoplasty should be adjusting the contours to where it blends in the face and it looks attractive, and it makes the whole face look attractive, not just the nose. The most beautiful nose on two different faces can look horrible versus beautiful, okay? Very, very important. So I'm very fortunate to have one of the biggest rhinoplasty practices here on the East Coast. I have people traveling to me from all kinds of countries, states in the United States, backgrounds, ethnicities, which is amazing to see what's important to a lot of these patients. And everybody has a different wish and has different demand. And my job is to listen carefully to my patients to see what is it that they're expecting, what do they like their nose to look like, help them to understand why they want a particular nose. And if I feel it's not a good idea, I try to explain it. Most of the time it's mutual. They're like, oh, I'm glad you mentioned that, or show like a mock after graphic of how their nose would look and would fit in their face, and let them see for themselves whether it fits in their face or not. So communication is key. You should choose a doctor that communicates well with you. Most of my work is before the surgery. When I go to the operating room, it's pure execution. I will never go to the operating room until I have a specific plan where both me and the patient have fully agreed to it and actually love the idea of it. And until then, I just don't do surgery because, again, a surgery is, rhinoplasty surgery is like art, of course, coupled with science. And the artistry in rhinoplasty is to design the nose. And the design has to do with what someone wants, and that means communication. So this is very important. So make sure when you have a rhinoplasty, for all of the above reasons, that you choose a surgeon that clearly communicates with you. The other thing you want to look out for is someone that has a lot of experience. I could tell you, out of all facial surgeries, rhinoplasty surgery is technically the most challenging procedure that we do. And what's even more important for the surgeon, to have an artistic eye, to know what's going to look good, and to have all the tools in their bag of tricks to be able to utilize when necessary. There's so many different techniques, from cartilage grafting, from maneuvers, suturing, that will reshape the nose. If the tools that you have are limited, your results are going to be limited. Okay, and that's most of the time what you see with signature noses. It's almost like a cookie cutter nose. The same technique is used for every nose. Well, you have to know all different. It's kind of like a basketball player that has a lot of moves. If you're a basketball player that the only thing you can do is shoot, well, you can't drive to the basket. If two people come towards you, you don't know what to do. And if they happen to be taller than you, there's no way you can shoot. So you're going to be very limited. But if you're a very versatile player, you can shoot, you can drive, you can dribble. Well, there is no holding you back. So it's very important that your rhinoplasty surgeon is very well experienced. And the only way you can gain experience is if you do a lot of something. I remember when I started my career about now 15 years ago, since my training finished, is that it was probably the most intimidating surgery. But I'm someone that I love challenges, and if I'm passionate about something, I don't stop educating myself and training to just get better at it. And now looking back, I've come a long way, and I'm thinking of the fact how important experience is, and just the frequency of doing something, and be very critical of your own work and listen very carefully to your patients. That's what made me today the surgeon that I am, and I keep sharing that with younger surgeons, with my colleagues, and I also let my patients know because it's very important that you have the utmost confidence in your doctor. So you're not afraid or scared about your outcome. There's nothing more scary about not knowing how you're going to look when you come out of the operating room, especially when it comes to rhinoplasty. Again, it's right in the middle of your face. You can't hide it. And, unfortunately, we live in a society where people happen to judge a lot. And if you have people in your family or your circles that just give you negative energy. Oh, look what you've done. You should have done it. You want to make sure that you kind of keep those people away, because the healing and the recovery of a rhinoplasty is really 6 months. Within those 6 months, a lot of things happen, and that brings me to the next topic of the recovery. Typically, the main recovery, what people understanding about recovery really is like, when can I go out and about, do the things that I normally do? Or when can I go again to the gym? So that's what most people actually mean by recovery. And then there is another recovery, which is, when is my nose fully settled? When will I see my final result? Meaning when all the swelling has gone down, when the nose has settled, etc. So that usually happens after 6 months or a year. In some cases, even up to 2 years, right? But that doesn't mean your nose is going to look terrible like you had surgery for 6 months or a year. No, that just means for the final result. There are changes that you can actually barely notice unless you look at your pictures from 6 months ago and compare it to the pictures from today. The main recovery is really 1 week, and that's when you have stitches, when you have tape, or if you have bony work done, a splint on your nose. All of those will come out after a week. When they come out, literally the next day, you could go out to the mall or go to work, and people actually won't notice that you had a rhinoplasty. You still have some swelling, but again, people that don't know you, they can't tell swelling. It's not like your nose is huge, okay? You will notice it because or people very close to you might notice it, and even those sometimes don't notice it, because a lot of times when we do rhinoplasty surgery, we downsize the nose, we reshape it, so make the contours more elegant, and swelling on top of that makes your nose not look much different, and as the swelling goes down, all of a sudden you see the changes. And that's what happens in the first 3 weeks. So about 80% of the swelling really goes away after 3 to 6 weeks, and that depends on your genetics, right? On your ethnicity, it depends on your diet. I always tell my patients to avoid eating outside because of the salt, if they eat home, don't consume salty diets, etc. And and then rest and sleep, and of course to hydrate plenty. Those will positively affect your recovery. So after 3 to 6 weeks, 80% of the swelling has gone down. That's when I get these lovely messages from my lovely patients that, oh, I love my nose, thank you so much. And that's when they start seeing the light at the end of the tunnel, which is why I do actually all of this. Nothing brings me more joy than these messages from my patients that I get from all over. And then really from then until the first 6 months, you pretty much are 90% there. So you get to actually enjoy your nose after a week, and from then on it just keeps getting better, okay? As to your breathing, one of the sayings I have is said, if something looks good, it usually functions and works good or works well. And vice versa, if something functions properly, it usually looks good. So never, ever, ever a rhinoplasty should be done, a cosmetic rhinoplasty should be done without addressing the function of the nose. Because the primary function of the nose is what? Breathing. So a good-looking nose that you can't breathe through, to me, it's worthless. It's almost unethical, okay? So it's very important that that's addressed. Unfortunately, many doctors, they don't address it, and that has to do because they're limited in the techniques and the experience that they have. So you have 3 or 4 maneuvers just to make the nose look better, but not addressing the function. As a matter of fact, in some cases, making the function worse. And that's why it's so important that you go to an experienced surgeon. And always ask that question and make sure you make that your priority. And if you can't get a straight answer, then just be cautious, get a different opinion. Rhinoplasty is one of those things, unless you do a lot of them, there is no way you can be good at them. I don't care how well you are with your hands, how well your hand-eye coordination is. You need to have practiced these maneuvers. You have to be familiar with all these techniques, from harvesting cartilage graft, molding the grafts, placing the grafts in place, making sure that when you do so, not only aesthetically it looks good, but also functionally it works well. Most importantly, that the function and aesthetics maintain for decades to come, and the nose doesn't, for example, collapse or shift after only a couple of years. Usually happens when overzealous surgeons removed too much cartilage or didn't strengthen weak cartilage that was already there. And when you don't address these problems, they will pop up. They come and haunt you, and that's when disappointment kicks in. Unfortunately, I do a lot of revision rhinoplasty. It's something I don't like to do. It's very challenging. Patients are usually very disappointed. They have a lot of trust issues just because of their past trauma. I'm passionate about helping those patients, but I always try to help patients not get into trouble in the first place. And the last thing I want to do is do revisions on my own surgeries. So again, your nose is my reputation, and you can rest assured that I will do whatever I can in my power to give you the nose that you want, and most importantly, make sure you can breathe through it. And if I feel I can't, I always respectfully will decline, and because the most important thing to me is your satisfaction. Make sure when you choose a rhinoplasty surgeon, again, you look for experience, you look for communication, be very clear about the outcome, make sure your surgeon is very clear about the outcome. And of course, I always use the 80-20 rule with my patients. I say 80% of the outcome of your nose is in my hands, 20% is in Mother Nature's hand. It has to do with healing, biology, DNA, your own recovery, meaning how you follow the instructions properly. Those 20% I can't control. And I always tell patients, if you're not going to be happy with 80% of the outcome, you're not a good candidate. There's no such thing as 100%. Of course, we always strive for it. Lucky for me, I can say that most of my patients, I am able to supersede their expectations, which is the most beautiful thing when we do the reveal and you see the joy and tears. That's what I'm shooting for. I'm shooting for the stars. But reality is 80-20. So keep that in mind. Don't stress too much about it. And the recovery, again, is not as bad as you think. As a matter of fact, my patients don't take pain medication. I don't actually use packings in the nose, very rarely, maybe 1% of the cases. So the recovery is not as bad as you might think. And for more information, you can look at my other videos or my social media, Instagram at Dr. Hamrah. I have a lot of reveals where you can watch patients' reactions. And hopefully this gave you a little more insight and understanding about rhinoplasty surgery. Thank you very much. This is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C. See you next time.